Sickle cell disease is an inherited blood disorder where hemoglobin, a red pigment inside the red cells that carries oxygen to all tissues, is abnormal. This abnormal hemoglobin, under certain conditions, makes the red cells to become stiff and assume a sickled shape. Sickle cell disease is prevalent in malaria zones of the world, such as sub-Saharan Africa, the Mediterranean, Middle East, and India. Caring for someone with sickle cell disease imposes a significant psychological and financial burden on carers. These challenges often disrupt family life and can lead to severe stress and hardship. To have the disease, a child must inherit a copy of sickle cell gene from each parent, either of which may have the disease or may be a carrier of the gene, where he or she is said to have sickle cell trait. Sickle red cells are rigid and inflexible and may be destroyed prematurely, spending between 10 and 20 days in circulation instead of about 120 days for normal red cells, leading to low blood count. Sickle red cells may also block small vessels to impede blood flow, thereby causing reduced oxygen delivery to tissues. This will lead to pain, frequent infections, and organ damage. Features of sickle cell disease can appear as early as 3 to 4 months, often starting around 5 to 6 months of life, with early signs including painful swelling in hands or feet, fatigue from anemia, and yellow skin or eyes. These symptoms may become worse during a period that is referred to as crisis, which is often triggered by lack of enough fluids in the body, known as dehydration, infections, very hot or very low temperature, and physical and emotional stress. The crisis may come in form of intense pain, affecting bones and joints, or in form of a more severe yellowness of the skin and eyes, and low blood count due to increased red cell destruction, or temporary shutdown of red cell production following viral infection, or by trapping of red cells in the spleen, making it to be massively enlarged to cause severe abdominal distension, pain, and dangerously low blood count. Diagnosis of sickle cell disease can be made through a blood test called hemoglobin electrophoresis, a test which separates hemoglobin into different types, by blood film examination, which provides a view of sickle cells, and by genetic testing, which directly identifies the specific gene abnormality. Someone with sickle cell disease needs to visit the hospital regularly for the proper management of his or her condition. Main goals of management of sickle cell disease focus on prevention of severe pain, managing other complaints such as breathing difficulties and extreme tiredness, and prevention of complications through lifestyle changes with drinking plenty of fluids or water, avoiding what triggers the crisis, and use of drugs such as folic acid, hydroxyurea, L-glutamine, and others. He or she also needs blood transfusion when necessary to treat severely low blood count, prevent stroke, and in severe cases, may need exchange blood transfusion where his or her blood is replaced by blood that contains normal red cells from a suitable donor. Bone marrow transplantation, a procedure which replaces the unhealthy bone marrow with healthy blood-forming cells obtained from a suitable donor, offers a potential cure. Transmission of sickle cell gene to future generations can be prevented through genetic counseling and reproductive choices, such as screening of carriers before marriage or pregnancy, pre-implantation and prenatal diagnoses in early pregnancy, in order to allow the couple to make informed decisions on the risk of having a child with sickle cell disease.